Why are cystic fibrosis carriers so common in some groups? Imagine a gene that has been shaped by history and survival, influencing how common it is in different populations. Cystic fibrosis carriers are people who carry one defective copy of the CFTR gene but do not have the disease. This gene mutation is inherited in an autosomal recessive way, meaning a person needs two copies of the mutation to develop cystic fibrosis. Carriers only have one, so they usually show no symptoms. In some groups, especially those of European descent, carrier rates are quite high. For example, about 1 in every 29 people of Northern European ancestry is a cystic fibrosis carrier. Among Ashkenazi Jews, the rate is also relatively high. In contrast, Hispanic Americans have about 1 in 46 carriers, African Americans around 1 in 61, and Asian Americans roughly 1 in 90. These differences are mainly due to how common certain CFTR gene mutations are in each population. Scientists believe that the high frequency of carriers in some groups is partly due to a phenomenon called heterozygote advantage. This means that carrying one defective gene might have provided some survival benefits in the past. For instance, carriers might have had increased resistance to certain infectious diseases like cholera or typhoid fever, which were common in Europe and affected populations historically. This advantage helped maintain the mutation in the gene pool, even though inheriting two defective copies causes cystic fibrosis. Because cystic fibrosis is recessive, carriers do not show symptoms but can pass the mutation to their children. If two carriers have a child, there is a 1 in 4 chance the child will inherit both defective copies and develop cystic fibrosis. There is a 50% chance the child will be a carrier, and a 25% chance the child will inherit two normal copies of the gene. Understanding whether someone is a carrier is important because, even without symptoms, carriers might have a slightly increased risk for some related health conditions. Carrier screening is especially recommended in populations with higher carrier rates to help with reproductive planning. These tests look for common CFTR mutations but might not find every rare mutation. So, the reason why some groups have more cystic fibrosis carriers is a mix of inheritance patterns and historical survival advantages that kept these gene mutations prevalent. This knowledge helps healthcare providers guide families, plan screenings, and understand the distribution of cystic fibrosis across different populations. Always remember, for personalized advice or testing, consulting healthcare professionals is the best step.